Well, to give you some perspective on just how important an encouraging word and just the slightest exposure can be in helping a student find a career pathway, you don't have to look any further than the president of the OSU Center for Health Sciences. A small-town girl and a college athlete, Dr. Kayse Shrum had not given much thought to medicine until one day after class when a professor asked her, why not?
You know, I'm from a rural community. My parents were not college graduates, and I really wasn't exposed to physicians other than, you know, on the occasional time that I was ill and went to see the doctor. And I enjoyed science, and it wasn't something that I had really ever considered doing until a professor asked me if I was going to go to medical school. And at that moment, you know, in my life, I really have reflected back on why didn't I think about that? I mean, his comment to me was, you know, you have the highest grade in my class. All these students, they've either been accepted or they're going. And I really think it wasn't because anyone had ever told me I couldn't. My parents were always very supportive, and I really believed I could do anything I wanted if I was willing to work hard towards it. But I think that we all need that moment for someone to say, you can and you should look at this and decide if it's for you. If that's something that inspires you or you can become passionate about. And many times those students don't have those opportunities. And so as I kind of have developed into a leadership role at the medical school, looking to solve the problem, I know that I'm not unique. I mean, there are many bright, talented students in rural Oklahoma, and I believe they're the solution to our problem in getting physicians to practice in rural Oklahoma if we can nurture that and we can find them and create a pathway that makes it easy. Because at the same time, you know, many of the schools in rural Oklahoma don't have counselors to be able to advise the students. And if they don't have someone who can advise them about college, we want to make that easy for them. So we've developed a pathway through FFA that is a handout that the ag teachers can give their students. And it says, you know, when you're in middle school, you can do these things. In high school, we encourage you to do these things. And then we're providing opportunities at the high school and college level for them to be engaged, so that we have the best prepared applicants to our medical school.
So how early do you start then?
Well, we start in some cases in middle school and definitely in high school. We have formal programs that we have created in order to start talking to high school students, in particular in rural areas, because, you know, many times those are the students who may not be exposed to a physician, may not be exposed to the idea of medicine as a career. They may have been involved in agriculture, and they like that lifestyle, but they've never thought of the idea that they can be a physician, practice in a rural community, and continue to have that agricultural lifestyle, but give back to their community in a different way.
Yeah, and I think that's a very interesting program. Isn't it called Blue Coat to White Coat,
Yes.
Working with FFA?
Yes, it is. It is our Blue Coat to White Coat program, and what we've done with them is really brought medicine into agriculture and into a rural lifestyle. And when we started that program, I think, you know, people on both sides of the fence kind of are scratching their heads and kind of curious about why would a medical school be at the state FFA convention? Why would we be at their CULT conferences, their leadership conferences? And that was very intentional because we want to have medicine embraced in rural communities. And there's nothing more rural than FFA.
Yeah.
And those students understand and embrace those communities, but they also have a lot of leadership skills. They understand hard work, they understand taking care of something. I mean, they have a lot of qualities that we're looking for in physicians.
What really determines where a physician will wind up practicing?
Well, if you kind of look at the literature, it points out that, you know, there are 4 things that will predict where a physician will practice, and it's where they grew up, where they do their undergraduate work, and if their medical school has an emphasis on primary care, rural populations, and where you do your residency training. And all of those are kind of looking at Where is a physician going to end, be mid-career? Because, we're really wanting to focus on getting physicians who are going to be there and become a part of the community and really have an impact on those communities, as opposed to some programs that will provide for loan forgiveness, that maybe sometimes those physicians don't stay in the community as long. So if we can find students that embrace that rural lifestyle and nurture that desire and be very intentional about the way we're training, and then the loan forgiveness is just a bonus to them.
Yeah, well, it's certainly an important initiative and one that's going to impact our entire state. Kayse Shrum, thank you so much for being here.
Yeah, thank you.